Good day, everyone. My name is Grace Osuji. I'm a student at Brahma University. I'm here to do a presentation on community assessment slotting journal. Driving around my community today, I have identified different things that the hospital need. What they really need is providing a resource that are appreciated directly towards the people in the community, educate them more on prevention and awareness of their health, and the greatest impact can be realized. So in New York City today, there are many clinics that New Yorkers can attend. New York has more hospitals than some states in the US. There are about 62 acute care hospitals in New York City. This clinic provides all types of service, including outpatient service, seizure health service, and immunization, testing and diagnostic service, among others. So there is a local public health service in New York. There are local community clinics which are considered affordable in the city of New York for the low income population. There will be more health centers for the low income population. Example are the public health in New York City, which include monitoring of health service, fostering community relationship, enforce law and regulation, among many other services. Vaccination rate in New York City. The immunization rate in New York City is over 90%. However, there are still challenges with the rate of vaccination. About 25,000 students are not vaccinated against communicable disease in New York City. So it was reported in 2019, almost 95% of all measles cases reported in US were in New York. So the disaster planning in New York City. So New York has its fair share of disaster, including the 9/11 bombing, Hurricane Sandy, COVID-19, among other disasters. In New York today, there are offices of emergency management and agencies that help to prevent disasters. So these agencies also comprise the NYS Disaster Preparedness Commission. When visiting this agency office can help one learn about disaster preparedness in New York. So the health education promotion in New York City. So the poster below is created awareness of mental issues in New York. Is seek to educate the community about mental stress and how to deal with it. So the next one is the vaccination education. So the poster below seek to educate the community in New York on importance of getting a flu shot and COVID-19 shot, how important it is to get all the shot. So another one is the veteran education on the veteran health. So on the poster below, explain where you can get information on the veteran affair. So the next one is the health education coronavirus pandemic, which is very important in our community or the whole world today. Coronavirus is a serious issue that is killing the whole people in the whole world. It has killed thousands of people. The world is dealing with unforeseen tragedy caused by COVID-19 pandemic. This COVID-19 has taken a significant toll on all our people all across the world. Here's this poster that informs the community on how it can be prevented and how people can protect themselves by getting the vaccination and then by washing your hands and covering your face, social distancing, and staying home. So the community is engaged by Department of Health New York. It's involved on issues that improve the health of the community. This includes the such immunization for the children and well children checkup, and the information is below. So the next one is a reflection. Healthcare and other services are accessible in New York. However, they are very expensive and it leads to margination of low-income community. This problem ought to be addressed. So with this COVID pandemic, as a healthcare provider, I have no doubt that we will overcome the dramatic of this virus. There will be more improvement and innovation that will result. I am a true believer that beyond all these crises, we are learning deeply both creativity and energetic changes in our lives. So with this COVID-19 pandemic, our community is well informed about the virus, prevention strategies, and knowledge of the science of immunity on how the virus spread than ever before. I believe that this will hopefully keep our community healthier as ever, even as we move beyond a COVID-19 pandemic disaster. This is all I'm going to say about running around on my community and what they need and the kind of education that we provide for them. And my reference is below. Thank you and have a nice day. Bye.